Well, welcome to another day and another Saturday at Coffee Breaks with Steve. I'm Steve, and we've got another great show in store. I'm glad you're here today. And so please put on the brakes, grab a cup of coffee, and join the conversation because it's time for Coffee Breaks with Steve. Love that catchy music. It gets me going. So does the coffee. Actually, the coffee probably does more for me in the morning. Hey, welcome to Coffee Breaks with Steve. If you are tuning in live, you're tuning in on Saturday, May 4th, 2024. We're in the month of May now. And if you're tuning in later on, whatever time and whatever day and time zone and place you're tuning in from, welcome as well. Do want you to participate, so please make sure you say hello in the chat as we're getting going here, or whenever you tune in. And once we get into our topic today, please do be a part of the conversation. Join the conversation. Shalane is here. Good morning, Shalane. Kathy Garlick. Carla Venturi is here. Jerry Thompson, Rick. Hello, everybody. All right. And if you are, join this group of people who are already tuning in and saying hi around our virtual coffee table, make sure that you do let us know that you are here, because we want to know. If you're here for the first time, I know that people tune in sometimes because of a specific topic or a specific guest, and you may be here for the first time. I'm trying to get my earphone cord set here. Sorry. If you're tuning in for the first time and joining us because you know our guest today or because this topic was of specific interest, make sure you do say hello in the chat. Let us know that you are here. And I will let you know, we've run into some questions recently about the crossover from the chat in YouTube and the chat in Facebook. And no, they don't actually talk to each other. So if you're tuning in on one, you won't see the chat information coming in on the other. And sometimes even the chats end up getting restricted for some reason. We're trying to clear that up as we go. Anyway, enough of that. What we're actually suggesting to people, and I'll say it here, is that we suggest that people tune in for the live stream on Facebook, because that's where the majority of the chat is taking place. You'll be able to see what other people are saying and respond to that. And then YouTube is also available, but it actually works much better if you're going back and watching this recorded later on. Okay, enough of that. I want to share a little bit of our sweet and savory and what is going on this week, and let you know that we got a couple of special days this week. First of all, this month is Women's Health Month. May is Women's Health Month, sometimes referred to as Women's Health Awareness Month, but it's just an opportunity to focus in on health issues specifically that affect women, encourage women to get the checkups that they should be getting, to become more and more aware of their own health needs and things that may impact them. So, and that will be a focus of our conversation and our topic in a few minutes. Also, what is today? Today is May 4th. May the 4th be with you. It's Star Wars Day. And I know there are some people out there who are diehard Star Wars fans, and that might be of particular interest to you. And so if you do celebrate May the 4th be with you, Star Wars Day, let us know that you do that in the chat, and let us know how you go about celebrating. Do you sit down and watch the original trilogy? Do you sit down and watch all 9 of the movies that are part of the Star Wars saga, including maybe even some that fall in between? How do you celebrate May 4th? May the 4th be with you. Also this week, tomorrow, May 5th, is Cinco de Mayo. You know, it's a day that actually gets a lot of confusion and misconception around it in terms of what it is. A lot of people think that Cinco de Mayo represents Mexican Independence Day, and it's actually not. It actually celebrates a date in 1862, the Battle of Puebla, when Mexican army defeated Napoleon III's army, French army, and it was a very notable and decisive battle in that particular war, and marked a change in Mexico's move toward its own state and state of being. And so that's why it's celebrated. And if I got that wrong and you know that there are some differences, let me know. I just know that we tend in this country particularly to celebrate Cinco de Mayo around the bar or the table. It usually has to do with drinking tequila and eating tacos. And it's actually within the Mexican culture and the Mexican community. It has a lot more going on than that. So just a little bit to be aware of there. Also, we do have some birthdays, and I want to mention those as well. But Jody Platt, who is a dear, dear friend, actually has appeared on Coffee Breaks with Steve some months ago. She and my wife, Carol, were guests on the show talking about friends and friendships. They've been very close friends for a number of years now. And so Jody is celebrating her birthday tomorrow. Happy birthday, Jody. And then also celebrating tomorrow, Nick Garlick, who happens to be my nephew, is celebrating a birthday. And so we want to wish Nick a happy birthday. And then we have an anniversary to celebrate this week as well. My sister Kathy, who is on here, and her husband Rod, I recently got to take a trip with them along with other family members to Europe, but they are celebrating their anniversary this week as well on May 6th. So happy anniversary to Rod and Kathy as they celebrate. They're very special, and you saw how many years there. I mean, I applaud anyone who is celebrating an anniversary going on for that many years. Yeah, Kathy says, "Holy cow, it's a long time." It is. Do you have a special day this week that I missed, and you want to make sure that we acknowledge and celebrate with you? You can put that in the chat. And if you have a special day coming up in the month of May, or maybe even in the months ahead that you'd like us to know about and get on our calendar, you can send an email to cbwsteve@comcast.net to make sure that we celebrate along with you, because we do. That's part of what we do here. We celebrate, and we celebrate the things that are going on in people's lives. And with that, I'd just like to know, what do you have going on this week? That maybe it's not a birthday, maybe it's not an anniversary or anything else of particular significance, but maybe you got something special happening this weekend or into this next week that you want to share. I actually get to fly out on Wednesday. I get to fly to Washington, D.C., and I'll be there for a couple of days participating. I don't know if you recall, but we've had a couple of episodes on here in past months last year where we shared about a very special organization, Saber 6. We had on the founder of the organization, Chris Kalenda, and the executive director, Didi Kiso, and talked about Saber 6, a foundation that works with veterans, and also shared on Veterans Day with Saber 6. And I get to go to Washington, D.C. this next week and participate in their annual gala event that's going to be held in D.C. And there are going to be some VIPs there. And it's going to be a lot of fun. So I've got that going on. And then after that, I'm going to be flying from D.C. to Providence, Rhode Island again, as Carol is still working her contract back in Rhode Island. And I will be spending about a week and a half from there. And so next week's Coffee Breaks will actually be from Rhode Island. So that's what I've got going on this week. And Shalane saying, yeah, they're the ones who got to, I vaguely remember jumping out the airplane thing. Yeah, that happened last November as well. Okay. Just glancing here at who's on and who's saying what about what they have going on. Again, if you have joined us in the last few minutes and have not yet said hello in the chat, make sure that you do that so that we know that you're here, and get ready to participate in our topic and our conversation here in the next few minutes. Just glancing at some comments, and yeah, cool. Dimash has a concert starting in a few short hours, Budapest. Carissa was putting that up there. Carissa, as you may recall, if you watched a few weeks ago when Carissa and Shalane were the showrunners for Coffee Break, Carissa talked about her participation in the Dimash USA fan club. And if you don't know who Dimash is, Dimash Kudaibergen, you can go back and find that episode from several weeks ago, or you can go online and look up Dimash Kudaibergen. If you're not familiar with his music, I encourage you, whether you love, I was going to say classical music. Dimash's style is not classical. Kathy, let's see. Kathy, I broke a tooth. Kathy, I broke a tooth on our trip, as you'll recall. I don't know are we dealing with some effects of the way the food was in, I don't know, one of the countries we were in. I don't know. When you staged the takeover of the coup. Right. Yes. All right. I'm glancing at this, and again, I will continue to look and see what kind of comments you're making, and do let us know anything special you got going on. We're going to be talking about women's health in a minute here, and I'm going to be introducing our guest, but I want to make sure, I'm going to say ahead of time, this was, as many of our guest conversations are these days, pre-recorded. But I would like you to be thinking now about some of your comments and questions and be listening carefully so you can ask our guest any questions you may have. And just a side note here, I'll check a couple of things just to make sure I'm not missing anything. Sorry. Okay. Always like to check. I also check to see if our guests who are planning on hopefully being on here are having any issues getting in, because I want to make sure that they are able to do so. And there we go. All right, back again. Tell you a little bit about our guest. Kirstin Harris is a board-certified nurse practitioner practicing in Ogden, Utah. She graduated from Weber State University in 2016 as a registered nurse working with cardiology patients. Kirstin graduated with a master's in nursing from Boise State University in 2023 and will be starting practice as a nurse practitioner in cardiology this summer. Born in Utah, Kirstin lives by the mountains where she likes to hike, kayak, and camp. She has 3 kids, 2 grandkids, and loves traveling with her husband. Specializing in women's health and an LGBTQ safe provider, Kirstin loves taking care of her patients and helping them live their best lives. So now I'm going to let you be a participant in my conversation with Kirstin Harris. And remember to ask your questions, place your comments, and any other things that you can think of about women's health, particularly women's heart health, in the chat so that we can follow that. Kirstin Harris, thank you for joining us on Coffee Breaks with Steve, and welcome to the show.
Thanks, Steve. Thanks for having me.
We're getting into now Women's Health Month, and that's going to be very relevant for our conversation today. But I always think it's great to start just giving people an idea about who you are and why you're here. So I think the first thing to ask you and to talk about was a medical career something you always envisioned for yourself? How did that journey take place?
So no, actually, this is my second career. Right out of high school, I moved to Oregon from Utah, and I kind of just jumped around in jobs until I found a position in insurance field, which is not exciting, but I really liked my job. My job at the end was that I was an account representative for specific places, and I would go help them enroll their benefits. So I really liked that job because I got to talk to people about things that are important, but that they don't understand. As high school, we don't teach about what insurance is and why you need it. And I really liked my job. I got to travel a lot and I got to meet a lot of different people, but it was coming clear that my position was going to sort of be eliminated as technology was advancing. They didn't need people to go and help people enroll with FaceTime and all that other stuff. So I knew that I needed to make a change, and I'd been going to a lot of hospitals and seeing a lot of nurses, and they really liked their job and found it rewarding. But specifically, I went and met a nurse practitioner named Alice. She was 82 years old and she was still practicing 1 day a week. She was beloved in her community, and everybody came up and had a story about Alice. And I thought to myself, I want to be Alice when I grow up. So I do have a medical background, medical history in my family. My grandma was a nurse. On my other side, your aunt was a nurse, and your family members in that side of family. So I've got a lot of people who are nurses around me, and it just kind of happened. And I spent the last 10 years working towards a nurse practitioner, and here I am.
Before you were a nurse practitioner, you were an RN for several years. And what are the key differences that people should be aware of between an RN and an NP, a registered nurse and a nurse practitioner? And I know that can vary a little bit state to state, but generally speaking, what are those differences?
Well, so I like the abbreviation, instead of calling myself an NP, an APRN, an advanced practice registered nurse. A nurse is trained at the bedside or in a clinic or whatever to help follow doctors' orders. An advanced practice registered nurse or a nurse practitioner writes those orders and helps define and create care plans for patients. They can diagnose and write prescriptions. They don't have the advanced training necessarily as a doctor, so there are restrictions. But in most states, you can see a nurse practitioner as your primary care.
Right.
I specifically am a cardiology nurse practitioner. I don't have any different training as a nurse practitioner because of that, but it's more of my training on the job and learning from the doctors that I support and work with.
Talk about that specific specialty and practice of yours and your interest in cardiology and how that came about and why. Why is that your main area of interest and focus?
Yeah, so I didn't know what kind of nurse I wanted to be. In nursing school, they always ask, what kind of nurse do you want to be? And most of the time it's, I want to be a baby nurse, or I want to do peds or something like that. And I absolutely did not want to do any of those things. That did not interest me. So I just kind of went from specialty to specialty as I was doing my school, because you go and work in the hospitals, and found interesting things, different things. I liked the ICU. What I didn't like was that the patients were asleep most of the time in an ICU. Yeah. I went to up the floor that I've worked on for the last 7 years, which is the cardiovascular thoracic unit at McCady Hospital in Ogden, Utah. And I loved taking care of heart patients because having heart problems is big and scary. You come into the hospital and you're afraid, but you can walk out feeling better sometimes than you have in a long time because we fixed the problem, and you can live a long and healthy life and be active. And it doesn't mean that you're death sentence or that you're confined to a chair or disability. So I really like that we can honestly make people's lives better and help them live the best lives possible.
I mentioned at the outset that we are at the start of Women's Health Month. May is Women's Health Month. Why is it specifically important, do you think, for there to be attention and focus on women's health? Why single that out?
Women's health in general is treated very differently. I've learned this from being on both sides of the table. Women are not always expressive enough in what they are feeling. Maybe they don't know how the right words to communicate, and they're often dismissed. The fact that hysteria comes from a woman's body part is not an accident. Yeah. And to the certain extent right now in medicine, it still is a thing. Very often women will go in and complain of fatigue or different things like that. And their doctor will say, oh, let's put you on an antidepressant, or you need to work out more, or go get your hair done. They don't take it too seriously. They really, really don't. So women just need a voice in a lot of ways. And with heart health, women have a huge risk in cardiovascular disease. It's the #1 killer of women in this country. And it's not just heart disease, which is a huge part, but also stroke. Because women have wide swings in their hormones, that can affect their cardiovascular disease a lot. Women have a tendency to be on medications that can affect things like blood clots and also affect their hormones. We play down hormones a lot, but I have a lot of mixed feelings about that, because one of the biggest things, someone comes in atrial fibrillation, the first thing we check are hormone levels, because that affects their heart disease. Women also have very different symptoms from men. Women, if they're having chest pain or angina, which would be a clue for someone to say, oh, we should check your heart, then that's great. But women typically don't have that feeling. They are tired, they're weak, they maybe feel nauseous a lot. And all of that can be cardiovascular related. And it's nothing to do with chest pain or breathlessness that we usually think of as something related to a heart condition.
Not just talking about ongoing or developing or chronic cardiac conditions for women, but a heart attack coming on, the onset of a heart attack similarly does not always have the same symptoms that we often associate.
No, typically women come in with a heart attack, they've had a couple of days of feeling like they had the flu or indigestion. That's they almost always complain of just being under the weather, and we find out that they've been infarcting for 3 days. Yeah. Another thing that happens with women is we are caretakers. We aren't going to take care of ourselves first. So we don't necessarily put our selves in first in line to go to the doctor to get their blood pressure managed. They're always looking out for everybody else and maybe not making sure that they get time to exercise. So as women, we sacrifice our health in a lot of ways.
It's interesting that you say that, because we often think about and make jokes about the fact that men try to avoid dealing with health issues. Men don't want to go see the doctor, their babies about it, and those types of things. And I'm not going to argue that point, because I can't. I know that there's a tremendous amount of truth to that, but we don't always think about that. We think about women as having a different sensibility when it comes to things like a doctor's appointment or that type of thing. But as you're pointing out, there are different reasons why women may not be effectively addressing their own health needs on a regular basis.
And we see people who have problems postpartum. And again, we are not paying enough attention to women and their cardiac symptoms. Even the fact that someone has gestational diabetes. Gestational diabetes puts you at increased risk for heart disease. So you definitely want to, if you've had gestational diabetes, that's not just, oh, I'm over my pregnancy, so I'm fine. That can still lead to risks. And then something that we talk about a lot in women's health is that after a woman has a baby, how often does she see her provider? They see them one time. They see them all at once. The baby is seen at 1 week and 2 weeks and 1 month and 6 weeks and all this. The woman is seen one time. And that isn't good enough.
With that in mind, at what age should women begin to be focused on cardiac health?
So most of our guidelines are similar to men. They should be checking their blood pressure beginning at age 30 or 35. They should be getting it checked at their annual visits. And again, this is kind of something funny to me, because men are so less likely to go to the doctor. Women go almost annually, and their blood pressure is checked at that visit, but I don't know how much it's discussed. Women should really be paying attention to that as soon as they start having babies. And from then on should be being very aware of their cholesterol and their blood pressure and making sure that both of those are under control. Again, we always talk about what are you using for birth control or what are you doing for this or that, but we don't pay enough attention to their heart.
What do you suggest to people in terms of advocating for themselves in situations where they may feel a concern, but it's being dismissed when they communicate that to a medical professional?
I have found that as a medical professional myself, we do tend to sometimes gloss over those things. Like, oh, well, that's completely normal. That's fine. You don't need to worry about it. But maybe it's something you are worried about, something in your past, something that you don't understand, even though we're saying, oh, it's okay. Really speaking up. And if you feel like the provider that you're seeing isn't giving you the attention you need, to say to them, I really need to see somebody else who is going to address this. In healthcare right now, as expensive as everything is, we're paying more out of pocket. A lot of people have HSAs and high deductible plans. You can't just willy-nilly be going to the doctor all the time or having tests all the time. And so you need to find a provider that will sit and listen to you. And old school providers, and again, I'm not throwing shade on all the other professionals, but they do tend to be a little less likely to sit and listen. Whereas I feel like newer doctors and medical providers are trying to spend that time holistically looking at the patient and addressing their needs. I know that a lot of the doctors that I work with that are out of fellowship in the last 5 or so years are much more likely to sit and listen and address those concerns. The other thing too is if you can see a nurse practitioners are way better listeners than doctors. It's just because of our training. We are trained to take care of people. Medical professionals like doctors and PAs, they are trained to treat diseases. And to me, that's the biggest difference and why I really like being a nurse practitioner and think that it's a great place to start. Obviously, if there's more that needs to be done, then they would escalate it to a doctor, but nurse practitioners are great at listening.
And I'm going to say this right now. We've been putting it up in the chat throughout this program, but if you have questions or your own comments or your own experiences that you would like to put in the chat, try to keep them positive. We don't want to mention if you've had an issue with a doctor or another medical professional. Let's not put names in there. But if you have questions, concerns, your own experiences that are related to this that you'd like to put in the chat so that we can see those, and Kirstin, when she has the opportunity, can even respond to those questions and comments, please do that. This is your conversation too. So make sure that you are doing that. There are a variety of holistic things regarding general health that relate to our cardiac health as well, right? I mean, it's so many different things that we may feel are secondary or can be set aside or ignored or treated as I don't have to worry about that right now, but it all relates to our overall health, including heart health.
Absolutely. Being overall healthy all relates to heart health. I have this slide for life's 8 essentials. The first one is something that everybody is a challenge for, and it's sleeping well. Sleeping well makes a huge, huge difference in your heart health and your health in general. I happen to live with a gentleman who has high blood pressure, and he was on a bunch of medications. His cardiologist said the biggest thing he needed to do was get more sleep. He was getting 5 or less hours of sleep a day. And we actually were able to take him off of a medication because he was getting more sleep, and that made a difference. He was sleep deprived, and that made his blood pressure go up, which is terrible for everything else.
Yeah. And exercise is another factor, and it doesn't have to be, I mean, exercise does not have to mean that you're doing Ironman events, right? Exercise is a basic thing that should be happening in some fashion every day and
Absolutely.
can be pretty simple and straightforward.
Just the simple act of walking is enough for cardiac health. We try and encourage 30 minutes a day. And if you can't do 30 straight minutes, break it up into 6 5-minute intervals. That's what I tell my patients to do who are deconditioned and can't do that. Eventually getting up to 30 minutes is great, and that's the goal. But if you can only do it in chunks, that's fine. But your heart and your vasculature, your vessels, your blood vessels, your arteries, everything wants you to be moving because that's how they get their best workouts.
We could, spend a lot of time talking about so many different things having to do with heart health. And again, I want to encourage people, if you have comments, questions, et cetera, certainly you can put them here. But also, Kirstin, as we wrap up, talk a little bit more about what are some resources that people can look at and potentially find even online. I mean, they can obviously should be checking with their own physician about specifics, but what are some resources that people might consider looking into for more information?
The best place to look is the American Heart Association. The AHA.org, I think is what it is, has always really good up-to-date information about what your blood pressure should be, ways to stop smoking, good ideas for recipes that are heart healthy, and different things like that. It's always reviewed by doctors, and it's the most up-to-date information. And there's sections, and most of the sections are really easy to read. It's not medical terms. It's intended for the lay person to read. So I always direct people there. Other places would be Mayo Clinic is always really good information for patients. So those are my 2 go-tos, and they have the most up-to-date facts and even things to ask your doctor. If you are concerned about heart health, cardiology, if you have a history of things that you need to talk about, it helps you have those difficult questions with your provider.
Yeah, that's great. Kirstin Harris, thank you so much for sharing your personal story and background, but also sharing such useful, vital information about health for all of us, and particularly focusing in on Women's Health Month of May, although it doesn't mean that for 31 days we focus on women's health. It's just a way to put it up in the focus, in the forefront, right? So thank you for being here. And again, looking forward to all of us continuing to find ways to protect and maintain good health.
Yeah, thanks for having me.
All right, my conversation with Kirstin Harris. And thank you. First of all, thanks, Kirstin, for being here and participating in the chat so people can make their comments and ask their questions. And thanks to all of you for continuing to do that and make sure that you're asking questions that are relevant. I want to share a few things here beyond or kind of accompanying, apparently I can't talk. This was, Kirstin shared some slides during the presentation. There were some elements that we put up, and this was one of them, just showing that, excuse me, time for some more coffee, hang on. For both men and women, that heart disease is the leading cause of death. You'll see other as a big wedge in there, but other is a miscellaneous combination of a bunch of other things. The one single that supersedes everything else is heart disease for both men and women. And these are from statistics from 2021, but that hasn't gone away in the last 3 years. And then there are some additional statistics that Kirstin provided us, talking about the fact that between the ages of 60 and 79, somewhere in the range of 75% of men and women will have some form of cardiovascular disease. And that 50% of those who have a myocardial infarction, which is a heart attack, have no symptoms. You can have silent heart attacks. That is a thing. And which is why things like regular checkups with your doctor, looking for changes that are taking place in your body, and being aware of things that may not seem normal. And a lot of medical professionals, including Kirstin, because I've had this conversation with her before, will tell you that push for things. If you're saying something isn't right, even if there aren't a lot of specifics, advocate for yourself, push to get the tests and the treatment that you think you need. And then this continues to go on to talk about additional statistics that you can read on your own. But just I think the last one on their uncontrolled risk factors, such as hypertension, which is high blood pressure, diabetes, obesity, contribute to the various outcomes. So just things to be aware of. And then just, again, some information from the American Heart Association about heart attack symptoms in women, which are different. As Kirstin pointed out, they're different for women than they are for men in many cases. She talked about the fact that it can, in fact, include some of the similar symptoms, the squeezing or pain in the chest or down an arm or in the jaw or other areas. But oftentimes, particularly for women, it does not manifest the same way. And both men and women can have symptoms of a heart attack that are not the typical slamming in the chest symptoms. But this is just a reminder that some of the indications you may experience could be very subtle. And to follow up on anything that does not appear to be normal is extraordinarily important. And then this also gives some information from the American Heart Association, again, on heart attack symptoms and stroke symptoms, which are also tied to cardiovascular health. And I would encourage you, as Kirstin did, to go to the American Heart Association site. And we do have the website. We put it in the chat, and it's up here as well. That I need the coffee today for sure. www.heart.org. And you can get a lot of great information there, as well as the fact that, get in touch with your primary care provider. Some of you on here may be saying, I really don't have a primary care provider. I haven't seen a medical professional in quite a long time. Okay, maybe it's time to start researching that a little bit. And I understand Kirstin mentioned this as well, that there are issues that sometimes surround availability and our capacity to get all the care that we need. But listen, the alternatives are not good. We all need to be looking out for our health in a variety of ways. So just some reminders that we need to be looking out for ourselves. And listen, this particularly being Women's Health Month, this can be true of men or women in your life, but particularly not only for you women out there, yes, for you women out there, but also any of the men watching this. You have women in your lives. You may have a spouse, you may have a sister, a mother, an aunt, a grandmother, a neighbor, a friend. Be an advocate for them, and maybe even be a prompter for them if you need to confront, intervene, and drive them to an appointment if that's what it comes down to. And if you become aware of a situation, to make sure that you are intervening urgently, but let's not let it get too urgent if we can help it, right? All right, that's my soapbox for the day. I do want to let you know a little, again, I want to thank you all for participating, and I want to checking comments again. And Kirstin's still answering questions and responding to comments out there, so continue to ask those. And I'm going to say again, if you're not tuning in live today and you're watching this later on, and you want to participate in the chat, we'll encourage Kirstin to come back and continue to look. I'll let her know if I see things coming up in the chat later on that are relevant. By the way, it looks like we may have addressed, we had to go in during the stream today, but it looks like we may have addressed some of the recent issues in YouTube with the chat, because I'm looking at the chat. It may just be my view of it, and I'm seeing all the comments and questions that have been coming up through the stream on both platforms showing up on YouTube. So we may have been able to effectively address. I think YouTube recently made some changes, but just a side note there, that let me know if you are on YouTube. Are you seeing the chat, and are you able to participate in the chat? I think we addressed some things, because it was not working even at the beginning of today's broadcast. All right, listen, I want to let you know some things that are coming up in the next few weeks on Coffee Breaks. And just next week, we have this guy is great. We've already recorded the conversation. His name is Cascade Cody. That's a stage name. He is a Pacific Northwest based folk singer, and really his own brand of folk, and a great guy and a great historian on folk music. It's really become a passion of his, and his story is fascinating in a variety of ways in terms of his own path musically, and just what he has to say about folk music. Please tune in next week and meet Cascade Cody. I think you'll enjoy that. By the way, we're going to mention in a few minutes the idea of you recommending topics and guests. This was someone who Chelan introduced me to. Someone she knows from theater in Yakima introduced me to Cascade Cody, and very much worthwhile. And then, speaking of Chelan, on the 18th, a couple of weeks out, Chelan's going to be back. I'm going to be busy doing some other things on the East Coast, and Chelan's taken over the show again. So you're going to want to tune in. I don't know yet. She and I need to talk about this, or maybe she's going to keep it till the last minute. I don't know what her topic is going to be. I don't know if she's having a guest on, but that's going to be up to her. It's her show on the 18th. So you'll want to tune in for that. Listen, even if you don't normally tune in, even if you just tuned in today to see what Kirstin had to say and to talk about women's heart health, I want to encourage you, anytime Chelan or Carissa or the combination take over the show, it's worthwhile. So you'll want to tune in a couple of weeks. And then in 3 weeks, we are at Memorial Day weekend. And look, we try to keep it, we don't go heavy necessarily on Coffee Breaks with Steve. And I don't think it's going to be heavy, but it's probably going to be emotional. And I want you to tune in. I want you to make a note right now on your calendar for May 25th, which is the Saturday of Memorial Day weekend. Tune into the show. You're going to meet Karen Pfeiffer, who is a Gold Star spouse, meaning that her spouse was killed in action in Afghanistan. And her story altogether, not just about that particular incident, but just her story overall, is going to be worth watching. A young lady who is amazing, fascinating, and you'll want to be here for that. Okay, please do. All right, what are the topics you would like to discuss? Who are the guests you would like to see? You can email us at cbwsteve@comcast.net with your ideas, with your introductions to potential guests, as Chelan did with Cascade Cody. And make sure that you let me know why. Let me know why you think that would be a great topic or a great guest. You never know. It may mean that you end up as a co-host on that particular episode, or a correspondent to participate. Not promising that, but it's happened. So you never know what may happen if you recommend, and you're going, oh, that's the last thing in the world I want to do. I'm not going to force you to do it, but it's an opportunity. So let me know if you've got ideas, because so many of the episodes that we have come from you sitting around this virtual coffee table and letting me know about something that would be relevant and that would be interesting for all of us. And then another reminder, I've been mentioning this over the last several weeks, but we are on YouTube as well. And if you are not a subscriber to the YouTube page, even YouTube channel, even if you typically tune in on Facebook, I'm asking you to do a couple of things. I'm asking you to go to the Facebook or the YouTube channel, Coffee Breaks with Steve YouTube channel, and be a subscriber. And go to the videos and like them and watch them and share the site and let other people know about it. Why? Because we want to get to the point where the algorithm for YouTube is putting Coffee Breaks with Steve up front. We're trying to tag our videos. We're trying to go in now and do some additional things with the videos to make them just easy to get to and easy to watch. And we want the topics to be out there, because how many people who may not have been tuning in on Facebook, may not know about us, need to hear what Kirstin Harris had to say today? How many people do you know who should be getting ready to tune into that Memorial Day episode in a few weeks and hear Karen Pfeiffer's story? The more we can get the YouTube channel out in front of people, the more people are going to be tuning in to be a part of these topics and to meet these guests. Not about me. It's about the fact that we've got a great group of people here. And listen, if it grows, we're never going to lose this core group. You are family, and it's always going to be family. But we want to get the topics that we are sharing and the guests who we are introducing out to a greater number of people. And our goal by the end of 2024 is to have a minimum of 500 subscribers to that YouTube channel. Why? Because that's going to push us to the forefront as people are doing searches for certain topics, and we're going to get the message out to even more people. Thank you for that. Thank you for letting me soapbox on that as well. All right, listen, we're getting close to the time, and you guys have been wonderful. Once again, I want to say a huge thank you to Kirstin Harris for sharing her expertise, for sharing her time, not only in recording our conversation, but in being here today to be part of the conversation. And to all of you who are part of the conversation, many of you every single week, thank you so much. And just want to encourage you once again to continue to tune in, continue to be part of the conversation. And even more importantly, we all have things that we can be passionate. We are passionate about. You have a voice. You have the ability to take action on things that are important to you. If it's women's health and you have women in your life, or you are a woman, and that's a passion and that's something you want to focus on, be that voice, be that advocate, be that ambassador. But whatever you're doing, whatever you're passionate about, find a way to make a difference in your world this week. We'll see you next time. God bless you. Have a great week.